Did you know that you might be taking a medication that directly affects your memory? Or worse, that perhaps one of your parents, or someone you hold dear, is already taking it without realizing that with each pill they're losing a part of themselves? This isn't about exaggeration. It isn't a theory or a conspiracy. Today I want to talk to you about something very real. Common medications prescribed every day to millions of older adults that are accelerating mental decline. Medications that can lead to a rapid loss of orientation, of clarity, and that in many cases can trigger dementia-like symptoms much earlier than expected. This isn't meant to scare you. This isn't alarmist clickbait. It's a call to stay alert, to educate yourself, to protect yourself. Because the most worrisome thing of all is that these drugs are in medicine cabinets, drawers, and pill organizers everywhere. They're in homes like yours, like mine, like those of our parents and grandparents. Science has already spoken. There are serious studies, medical research, and data showing how certain medications, though legal and prescribed by professionals, have a direct negative impact on the aging brain. And the hardest truth is that countless people are losing their mental clarity without even knowing why. Today, I'm going to tell you about 9 very popular medications, ones you may have already taken or might be taking right now. We'll analyze each one, understand how it acts in the body, why it's dangerous, and what you can do about it. Because yes, there are alternatives, and yes, you can make safer choices, but only if you're well informed. So stay with me. Don't lose a single second of this video, because the information you're about to hear could mean the difference between living with clarity or with confusion. And before we begin, I want to get to know you. Tell me in the comments how old you are and where you're watching this video from. I'll love reading your messages. We have important data, real-life examples, and warnings ahead that could change lives. Let's get started. Tag. As we grow older, our entire body changes, but the brain, in particular, becomes far more sensitive. It no longer responds to medications as it did in youth. What once felt like a normal dose can now have much more intense, even dangerous effects. The brain's metabolism slows down. The blood-brain barrier, the natural protection that prevents toxic substances from reaching the brain, weakens. That means certain compounds that used to be filtered or tolerated without issue now pass through easily and reach neurons directly, affecting them. Moreover, the liver and kidneys, the organs responsible for eliminating medications, also lose efficiency with age. So many drugs accumulate longer in an older person's body, remaining active beyond what's considered safe. All of this makes the aging brain far more vulnerable. Some substances that seem harmless, or that were prescribed with good intentions, can cause severe side effects: confusion, disorientation, memory loss, personality changes, even hallucinations. And here lies an even bigger problem. Often neither patients nor their families are warned about these risks. Doctors, out of habit or lack of awareness, prescribe medications without reviewing whether they're appropriate for the patient's age, medical history, and cognitive condition. This gives rise to what's called iatrogenic dementia. That is, a type of mental deterioration caused directly by medications, not by Alzheimer's, not by a stroke, not by natural causes, but by treatments poorly adjusted to the patient's stage of life. Let me tell you about Claire, a 79-year-old woman who was completely independent. She lived alone, went for walks every day, and loved reading mystery novels. But one day she began to suffer from insomnia. She went to the doctor, who prescribed a sleeping pill. From the first week on, her daughter noticed that Claire was slowing down, repeating herself, and mixing up days. Soon she even forgot names. Then she couldn't remember if she had eaten or not. In just 3 months, she went from being a lucid woman to someone who needed supervision. The cause? The medication she was prescribed was affecting her central nervous system. What began as help for sleep ended up accelerating her cognitive decline. This shouldn't happen, but it does, every day, in homes, hospitals, and care facilities. Because nobody explained to Claire, or to her daughter, that this medication, in older adults, can cause neurological harm. That's why this video is so important. We're going to speak plainly. You deserve to know what you're taking, how it works in your body, and what risks it carries at your age. Not to stop treatments on your own, but so you can talk to your doctor from an informed position. Now that we understand how the brain changes with age and why certain medications can do so much damage, let's dive into the topic that worries me most: the names, classes, and effects of those 9 medications you need to know. We'll go through them one by one. Like, medication. 1. Benzodiazepines. Perhaps you don't recognize the technical name, but you've certainly heard of these. Diazepam, lorazepam, clonazepam, alprazolam. Also known by brand names such as Valium, Ativan, Rivotril, or Xanax. What are they prescribed for? Generally for anxiety, insomnia, panic attacks, and even to relax muscles. And they work, at least in the beginning. They calm you, help you sleep, give you that sense of peace we crave when we're nervous or overwhelmed. But here's the problem. In older adults, these medications can profoundly disrupt brain function. They not only affect balance and increase fall risk, but they also impair short-term memory, generate mental confusion, and with chronic use, raise the risk of dementia, including Alzheimer's disease. Numerous studies have demonstrated this relationship, especially when used for more than 3 months. What starts as a temporary aid for sleep or calm can turn into a silent and dangerous dependency. Let me share Mary's story. A 78-year-old woman beloved in her community. She was always active, joined reading groups, cooked for her grandchildren, and loved tending her plants. But after an anxiety episode following her husband's passing, her doctor prescribed an anxiolytic, lorazepam. At first, it was a relief. She slept better and felt calmer. But months passed, then years, and Mary continued taking it every night, without interruption. One day, her daughter noticed odd things. Mary repeated stories she'd just told, mixed up her grandchildren's names, left the gas stove on, and couldn't remember if she'd eaten. The change was so gradual that at first nobody suspected the medication. They thought it was just age or grief. But when they consulted a new doctor, he reviewed all her medications and told them something that chilled them. This drug you've been taking for years is too potent for your age. It's affecting your memory. Much of what you think is Alzheimer's may actually be the benzodiazepine. They began a very slow, careful taper. Though they couldn't reverse all the damage, some symptoms improved. This case is not isolated. There are thousands of Marys losing mental clarity without knowing the culprit isn't time, but a pill they took thinking it would help. So if you're taking any benzodiazepine, or know someone who is, talk to your doctor. It's not about quitting on your own, but asking, is this really necessary? Are there safer alternatives? Can the dose be reduced? Remember, in later life, what was once safe can become risky, and caring for your mind is as important as caring for your body. Now that we know this first group, let's move on to the next medication that could be undermining your health without your knowledge. Tech. Medication. 2. Anticolinergics. Now let's discuss a group of medications even more common, yet far less understood: anticolinergics. You might not recognize that term at first glance, but these drugs are everywhere. They're used to treat allergies, motion sickness, digestive issues, urinary incontinence, and even depression. Worryingly, many are sold over the counter. Some well-known examples are antihistamines, like diphenhydramine, which appears in sleep aids and allergy remedies, certain nasal decongestants, or cold pills. Also bladder drugs like oxybutynin, and older antidepressants such as amitriptyline. What do they have in common? They block an essential substance in the brain, acetylcholine. This neurotransmitter is vital for memory, attention, and clear thinking. Without it, neural connections weaken, and cognitive decline accelerates. In younger people, the body can partly compensate for these effects, but in older adults, the impact is much greater. When acetylcholine levels drop, problems arise: confusion, forgetfulness, disorientation, even hallucinations. There are robust studies showing prolonged use of these medications increases dementia risk. And the most alarming thing is that they're often prescribed without warning, as if harmless. Let me tell you Andrew's story, an 81-year-old man who was sharp and active. Despite his age, he still drove, read the newspaper every morning, and cared for his garden with dedication. But he began suffering from seasonal allergies, and the pharmacist recommended an antihistamine to help him sleep at night. They said it was mild and safe. The first week, Andrew slept better. But soon his wife noticed something was off. He would get up at night talking to himself, saying incoherent things, and began seeing shadows at the edges of the room. By day, he'd forget recent conversations, mix up his house keys, and sometimes not even know where he was. Alarmed, they went to the doctor. After ruling out other causes, the physician reviewed his medications and pointed to the culprit, the antihistamine. They stopped it immediately, and over time some symptoms disappeared, but others remained. What makes this sadder is that it all could have been prevented. Andrew had no neurological issues before taking that pill. That's why checking the pill box is so vital. Many older adults are taking anticolinergic drugs without knowing it. They often hide inside sleep combinations, stomach remedies, nerve treatments, or bladder medications. If you or someone close to you is using them, especially regularly or for a long time, talk to a healthcare professional. There are safer alternatives, and often simply adjusting the dose or schedule can make all the difference. Your mind is your greatest treasure. Protecting it starts with knowing what you're taking. Let's now move on to another mass-used medication that can also severely affect the aging brain. Cook. Medication 3. Tricyclic antidepressants. Tricyclic antidepressants were, for many years, the primary tool for treating depression. Drugs like amitriptyline or nortriptyline were standard across ages. And even today, despite being old-fashioned, they're still prescribed, especially to older adults. Why? Because some physicians have known them for decades. They're cheaper than modern options, and they're also used for insomnia, chronic pain, fibromyalgia, and even migraines. But there's a big problem. These medications weren't designed for the aging brain, and their impact can be devastating. Tricyclics have anticholinergic effects, just like the drugs we discussed earlier. That means they block acetylcholine, the key neurotransmitter for memory, attention, and clear thinking. They can also affect balance, coordination, and even disturb heart rhythm. Many older patients on these drugs begin experiencing confusion, constant drowsiness, disorientation, and in severe cases, delirium. The worst part is these symptoms mimic dementia, trapping the patient in a vicious cycle. Let me tell you Dorothy's story. A 79-year-old woman living on her own, fully capable, but suffering from chronic joint pain that kept her from sleeping. Her doctor prescribed low-dose amitriptyline, not for depression, but as an analgesic sedative at night. At first, it seemed to work. She slept better and had less pain. But weeks later, her daughter noticed Dorothy becoming clumsier, forgetting dates, repeating herself, and struggling to follow conversations. One day, she even confused the gas stove for the electric cooker, nearly causing an accident. When they reviewed her medications, they discovered the amitriptyline was directly undermining her mental clarity. By reducing and replacing the treatment, many of those issues reversed. But the experience left a mark. The good news is that today, there are much safer alternatives. Modern antidepressants, like selective serotonin reuptake inhibitors, such as sertraline or escitalopram, are far more tolerable for older adults and lack the severe neurological side effects. Even for pain or insomnia, there are non-drug approaches or gentler combinations. The key is not to settle. If you or a loved one is taking amitriptyline, nortriptyline, or another tricyclic, and especially if there are signs of confusion, mental sluggishness, or frequent falls, it's time to talk to the doctor. Remember, it's not about eliminating all medications, but reviewing, questioning, and adapting. Because in later life, what once worked well can become a silent trap. Now let's continue with the next medication that, though prescribed with good intentions, may be dimming the minds of those we love most. Medication 4. Antipsychotics. Now we're stepping into delicate territory. We're going to talk about antipsychotics, medications like risperidone or quetiapine that are commonly used in older adults, especially those with Alzheimer's disease or advanced dementia. In theory, they're intended to treat very specific symptoms: severe agitation, delusions, hallucinations, or aggressive behaviors. In practice, however, they're prescribed far too often, and frequently for reasons that don't justify their use. Many physicians simply prescribe them to calm the patient, so they won't get up at night, so they won't scream, so they won't disturb the staff at a nursing home. In other words, to control behavior, not to address the real cause. And here lies the true danger. Antipsychotics are extremely powerful drugs that profoundly alter brain chemistry. In an older person whose nervous system is already more fragile, the effects can be devastating. Excessive sedation is one of the first warning signs. The patient appears calmer, but also more distant, as if they've been switched off. But it doesn't end there. These drugs increase the risk of falls, confusion, incontinence, muscle rigidity, and in some cases they can even lead to sudden death. Indeed, multiple international medical authorities have warned that their use in people with dementia should be limited to the bare minimum and under strict supervision. Let me share Sylvia's story. Sylvia is the daughter of a woman diagnosed with Alzheimer's. Her mother, 85 years old, lived in a care home and sometimes became agitated. Some afternoons she'd pace, muttering phrases. One day, without consulting Sylvia, the medical team decided to give her risperidone. It will help her calm down, they said. And yes, Sylvia noticed that her mother no longer wondered so much, but she also noticed her mother stopped speaking as before. She didn't smile. She stared into space and barely reacted when Sylvia visited. When Sylvia demanded explanations, they spoke of necessary adjustments for Alzheimer's. Sylvia wasn't satisfied. She sought a second opinion and discovered the dosage was unnecessarily high. With medical support, they tapered it gradually, and over time her mother regained moments of clarity and connection. It wasn't perfect, but it was far better than that artificially induced drowsiness. The scariest part is that these cases happen every single day. There are older adults medicated without full family consent, without a clear explanation of the risks. And worst of all, many never recover the vitality they had before treatment. That's why, if you or a loved one is on antipsychotics, especially in contexts of dementia or agitation, it's vital to ask, is it really necessary? Is there a less invasive alternative? Are we treating the person or merely trying to silence them? Calm should never come at the cost of turning off the mind or stealing someone's last moments of awareness. Medication. 5. Sleeping medications, non-benzodiazepine hypnotics. Sleeping well after 70 years of age becomes, for many, a true challenge. Sleep grows lighter, it's easily interrupted, and sometimes it just doesn't come. Nights can feel endless, and insomnia, despairing. In that moment of frustration, many turn to so-called sleeping medications, particularly non-benzodiazepine hypnotics like zolpidem or isoprene. Also known as Z drugs, they were developed as safer alternatives to traditional benzodiazepines, and while they may offer temporary relief, they carry serious risks, especially in older adults. Their main problem is that they don't just induce sleep, they alter consciousness. Many seniors taking zolpidem, for example, experience sleepwalking episodes, hallucinations, nocturnal disorientation, or perform actions they don't remember the next morning. People rising to cook in the dead of night, wandering out the front door unknowingly, or suffering severe falls while half asleep are more common than we realize. Furthermore, with prolonged use, these drugs foster tolerance and dependence, meaning higher doses become necessary for the same effect. And when you try to stop, insomnia returns stronger, accompanied by withdrawal symptoms. Consider Ronald's case. He was 76, widowed, and began suffering insomnia. His doctor prescribed zolpidem to rest a bit better. At first, it was a relief. He slept through the night. But over time, his awakenings grew confused. One night, he fell down the stairs. Another, at 3 in the morning, he called his daughter, convinced it was daytime. When they decided to stop the medication, it wasn't easy. Ronald endured several sleepless nights, anxious and disoriented. They had to taper the dose slowly and support him with healthy sleep routines. So what are those routines? They're called sleep hygiene, and they can make all the difference. Turn off screens at least 1 hour before bedtime. Have a light, early dinner. Avoid coffee in the afternoon. Read a book. Enjoy a relaxing herbal tea. Keep a regular schedule. And above all, accept that sleep in later years isn't always the same, and that doesn't mean something is wrong. There are also approaches like low-dose melatonin, cognitive behavioral therapy for insomnia, or guided relaxation exercises that have shown excellent results in older adults. Sleep is fundamental for brain health, but the goal shouldn't be just to sleep at any cost, but to sleep well and safely. Often that means reassessing what's in the medicine cabinet. Wahang. Medication. 6. First-generation antihistamines. Now we arrive at a drug many consider harmless, a simple over-the-counter aid, diphenhydramine. Known by familiar trade names like Benadryl, it's commonly used for allergies, colds, or even as a mild sleep aid. What most people don't know is that diphenhydramine belongs to a class called first-generation antihistamines, and in older adults, it can have very serious cognitive side effects. Here's why. These drugs block acetylcholine, a neurotransmitter essential for memory, attention, and learning. Aging brains already suffer a natural decline in acetylcholine. By further blocking it, these medications can cause progressive mental deterioration, often mistaken for Alzheimer's symptoms. Since they're sold over the counter in many countries, seniors may take them for weeks, months, or even years without realizing the harm they're inflicting. Take Anthony's story. He was 78 and living alone, with difficulty sleeping. His granddaughter recommended an over-the-counter antihistamine because it helped her relax. At first, it seemed to work. Anthony fell asleep faster and felt rested. But after months, his family noticed small changes: forgetfulness, confusion about dates and names. One day he got lost on a street he'd walked hundreds of times. The family feared the onset of dementia. A neurologist reviewed their questions and asked to see Anthony's medications. There it was. He'd been using diphenhydramine nightly for more than 6 months. The specialist explained that in older people, anticolinergic antihistamines can cause iatrogenic dementia, a drug-induced cognitive decline. Anthony stopped the drug under medical supervision. While he didn't fully recover his mental agility, he did halt the progression and regained much of his independence. This case isn't unique. Multiple studies confirm that prolonged use of anticolinergic antihistamines is linked to higher rates of cognitive decline and dementia in seniors. The alarming part? Many don't even consider them strong medications. They're right on the bedside table, taken unchecked. That's why, if you or someone close is using these pills for sleep or allergy relief, it's vital to speak with a doctor and explore safer alternatives. Remember, what seems like an innocent helper can become a silent enemy of memory and mental clarity. Medication. 7. Opioid analgesics. There is a class of medication created with a noble purpose: to relieve intense pain. And no one disputes that in some cases they're necessary. But in recent years, their use has expanded beyond measure. Now, even older adults with chronic aches are prescribed opioids that could be managed differently. We're talking about opioid analgesics like tramadol or morphine. You've likely heard their names in the context of terminal care or major surgery. Yet in many countries, they're prescribed for common complaints like arthritis, back pain, or minor fall injuries. For seniors, the risks often far outweigh the benefits. Opioids don't just dull pain, they dull the mind. Side effects can include mental confusion, disorientation, extreme drowsiness, and slowed reflexes, all of which dramatically increase the risk of falls, fractures, and accidents, and contribute to progressive cognitive decline. Imagine Helen's situation. At 80, she began taking tramadol for knee pain. At first, it helped her sleep and eased the discomfort. But days later, her family noticed she was quieter, no longer contributing to conversations, forgetting where she left her keys, losing track of the day of the week. One morning, she mixed up her breakfast pill with her nighttime dose and ended up with a double dose. She felt dizzy, fainted in the bathroom, and suffered a head injury requiring hospitalization. There, the doctor said, Helen didn't need tramadol. Her pain could be managed with physical therapy, controlled activity, and safer pain relievers. These scenarios repeat worldwide. Opioids can trigger what's known as drug-induced delirium in seniors, manifesting as disorientation, hallucinations, concentration difficulties, and behavioral changes, often mistaken for irreversible cognitive decline. But it isn't. Sometimes it's merely the cumulative effect of the drug. There's another issue: tolerance. The body quickly adapts to opioids, requiring higher doses for the same effect. This increases the risk of dependence and makes stopping treatment a complex process. So, what can you do? First, question whether the pain truly justifies opioids. Is it unbearable, or can it be managed another way? Second, seek safer alternatives: mild analgesics, physiotherapy, supervised exercise, occupational therapy. And third, if you're already on an opioid, talk to your doctor about tapering off or switching to a different treatment. Because what's at stake isn't only your mobility, it's your mental clarity, autonomy, and quality of life. Tank. Medication. 8. Corticosteroids, chronic use. Corticosteroids, medications like prednisone, are incredibly powerful. They're designed to control inflammation and are used for conditions such as rheumatoid arthritis, respiratory diseases, lupus, and other autoimmune disorders. When used for short periods under strict medical supervision, they can be life-saving. The problem arises when they become a daily routine for months or even years. While inflammation subsides, side effects accumulate, especially in the brain. In older adults, prolonged corticosteroid use can produce symptoms strikingly similar to early dementia: persistent insomnia, agitation, extreme mood swings, unexplained anxiety, and even episodes of deep confusion. Some patients develop corticosteroid-induced psychosis, hallucinations, delirium, and a loss of touch with reality. I'll tell you about Mrs. Meredith's experience. At 79, she had been on daily prednisone for over a year to manage her arthritis. Initially, her mobility improved dramatically, and the drug seemed miraculous. But gradually, her personality changed. First came the sleepless nights, then sudden outbursts of anger, and eventually inconsolable crying spells for no apparent reason. Her family assumed it was severe depression, until a neurologist asked, "Has she been on chronic corticosteroids?" Reviewing her records, it was clear the medication was disrupting her brain chemistry and emotional balance. And that's not all. Chronic corticosteroids also weaken bones, increase fracture risk, affect the heart, and create overall vulnerability in seniors. But the most silent, invisible impact is on the mind. Loss of emotional control, difficulty concentrating, memory lapses, racing thoughts. These aren't always signs of a brain disease. Sometimes they're side effects of a drug the body can no longer handle. Worst of all, patients aren't always informed of these risks. The prescription is renewed. They keep taking it. Until one day, the person you knew seems gone. That's why, if you or a loved one is on long-term corticosteroids, talk to a specialist. Ask whether the treatment is still necessary, explore less aggressive alternatives, and consider tapering the dose. Because while the body may thank you for temporary relief, the mind could be paying a very high price. And there's still one more medication group on our list. One of the most common, normalized, and misunderstood: sleeping pills. Let's talk about them. Medication 9. Medications for the overactive bladder. There are health issues that might not seem terribly serious, yet they deeply affect a person's quality of life. One of these is the overactive bladder. That urgent, frequent need to urinate can disrupt sleep, limit outings, and even cause embarrassment or social withdrawal. And to treat it, many doctors prescribe medications such as oxybutynin or tolterodine. They seem like the ideal solution. They help reduce urgency, improve control, and allow sleeping with fewer interruptions. But what many do not realize is that these drugs work by blocking cholinergic receptors in the body, especially in the nervous system. And that has a direct consequence. They decrease the activity of acetylcholine, a neurotransmitter essential for memory and learning. The result? A slower mind, a weaker memory, and an increasing risk of developing cognitive impairment or even dementia if use continues over time. Listen to this story. Louis, 77 years old. He had started experiencing urinary urgencies, and after several uncomfortable episodes, his doctor prescribed oxybutynin. At first, it was a relief. He could sleep through the night again, and he felt encouraged to go out more often. But then the lapses began. First, he forgot whether he had taken the pill. Then he locked his keys inside the car. One time, he mixed up the date of a medical appointment and didn't show up. His daughter noticed that he struggled to find words and repeated stories without realizing it. They thought it was the onset of dementia. But a geriatrician reviewed his medications and explained that the oxybutynin could be causing that mental decline. They tapered off the treatment under supervision, and within weeks, Louis began to improve. He never returned completely to his former self, but his clarity did come back, at least in part. The drug that helped his bladder was, at the same time, clouding his mind. This case is not isolated. It's more common than people think. And the worst part is that these medications are prescribed all too lightly, without warning the patient or their family about the nervous system side effects, without evaluating alternatives, without a follow-up plan. But there are other options. There are behavioral therapies, like pelvic floor exercises, bladder control techniques, specialized physiotherapy, and even dietary adjustments that can improve bladder function without harming the mind. In more severe cases, there are newer treatments with fewer side effects, though they aren't always offered as a first choice. So if you or someone you know is taking medication for an overactive bladder, ask yourself, is the risk to the brain worth it? Is the patient fully informed about what they're really taking? Talk to your doctor. Ask whether it's possible to try alternatives. Weigh whether the benefits justify the risks, especially if there are already signs of confusion, forgetfulness, or disorientation. Because sometimes, in the effort to control the body, we're unknowingly losing the clarity of the mind. SAG. Warning signs that may indicate drug-induced cognitive decline. Sometimes dementia doesn't begin with a diagnosis. It begins with a strange look, a subtle confusion, a forgetfulness that feels out of place. Many older adults, or their families, notice something is off, but don't know what to attribute it to. Some think it's stress, others say it's just age, and many ignore it until the symptoms become impossible to hide. What few know is that certain medications can be behind these first changes, and if they aren't caught in time, they can cause damage that becomes harder to reverse over the years. That's why it's essential to recognize the warning signs of drug-induced cognitive decline. The first sign is a sudden mood change. If someone who used to be calm becomes irritable, aggressive, nervous, or extremely anxious for no apparent reason, that warrants attention. Especially if these changes coincide with the start of a new prescription or a dosage adjustment. The second sign is rapidly progressing memory loss. Forgetting keys or mixing up the day of the week can happen occasionally, but if someone begins asking the same questions multiple times a day, forgetting close names, or constantly misplacing objects, it's time to review what medications they're taking. Another clear sign is confusion about time and place. Has an older person ever failed to recognize their own home for a few minutes? Thought they were someplace else, or not known the time of day? That shouldn't happen, and certainly not frequently. Be alert too for lack of attention and concentration. When someone starts getting easily distracted, can't follow a simple conversation, or loses the thread of a sentence, they might be experiencing an adverse medication effect. And perhaps the most alarming, failing to recognize these signs as a problem. Many people don't notice their own symptoms. That's why it's so important for family and friends to stay vigilant. If you see these changes in someone close to you, don't downplay them. And if you're feeling them yourself, don't dismiss them as inevitable. So what should you do if you notice any of these signs? First, review every medication you're taking. Prescriptions, over-the-counter drugs, supplements, even natural remedies. Make a complete list. Second, talk with your trusted doctor or pharmacist. Ask if any of those drugs could be affecting your cognitive function. Request safer alternatives. Not every professional mentions these risks proactively, so you must raise the issue. Third, don't make decisions on your own. Never stop a treatment without consulting a professional. But you can, and should, ask questions, inform yourself, and advocate for your mental health. Because often, the difference between a clear mind and a clouded one isn't a disease. It's a pill that no one bothered to explain. And most importantly, you're not alone. Thousands of people are waking up to this reality. The earlier these signs are detected, the greater the chances of reversing or improving the situation. What to ask your doctor and how to take control of your treatment. One of the hardest things to accept as we age is that feeling of losing control. First it was your schedule, then your mobility, and now perhaps your medications. One prescription after another, one more pill, and another. Until one day you ask, why am I taking all this? Do I really need it? If you've ever felt like you're taking medicines without understanding why, you're not alone. Many older adults trust their doctors completely, and that's fine. But it's also crucial to remember this. You have the right to understand, to ask, and to decide. So if you're worried about how your medications might be affecting your mind, here's something very important. Your doctor won't be bothered if you ask well-thought-out questions. On the contrary, a good professional welcomes them. Here's a clear guide on what you can do. First, speak honestly and without fear. You don't need medical expertise. Just be clear about what you feel. You could say, for example, "Doctor, I've been feeling more confused lately, and I've read that some medications can affect memory. Could we review what I'm taking together?" This phrase opens the door to an informed adult conversation that's necessary. Second, request a comprehensive medication review. Bring a detailed list of everything you take: prescriptions, vitamins, supplements, even herbal teas or over-the-counter pills. Ask the doctor or pharmacist to evaluate whether any of those could be affecting your nervous system or memory. Some side effects aren't always mentioned, but they're documented. Third, ask about safer alternatives. Not all drugs linked to cognitive decline are essential. Some have newer substitutes with fewer brain effects. Others can be reduced. In some cases, they can be phased out entirely. And here's something fundamental. You have the right to do so. You have the right to ask. You have the right to understand what you're taking and why. You have the right to seek a second opinion if you don't feel heard. You have the right to refuse treatment if you disagree, as long as you understand the risks and benefits. Not everything prescribed is mandatory. Medicine isn't an order, it's a shared decision. It's not about distrusting doctors, it's about actively participating in your choices. Your health is yours, your mind is yours. Remember, the first step to protecting your memory is getting informed and speaking up clearly. And if you're not sure where to start, save this video and review these questions before your next appointment. In the next segment, we'll discuss something often overlooked: the medications you don't take, those of your spouse, your mother, your father, your grandmother, and how they might affect the way they speak, behave, or recognize you. Get ready, because what comes next could help you save the memory of someone you love. Tag. If you've made it this far, I want to tell you something very important. This video wasn't created to sow fear. It was created to give you power, the power to decide, the power of information, the power to protect what matters most, your mind. It's not about rejecting every medication. Many save lives, many relieve pain, many are necessary. But there are also others that you might be taking without knowing what they do, that perhaps you've accumulated over the years, prescription after prescription, without anyone checking if you still need them. And that silent neglect, that blind trust, can come at too high a cost. Drug-induced dementia exists. Memory loss caused by medications isn't a myth. It's not a coincidence. It's a real risk that many are experiencing, without knowing why they're forgetting their name, their address, or even the faces of their grandchildren. But something else is real too. It can be prevented. Aging with clarity is possible. Maintaining mental sharpness for more years is possible. But to achieve it, we must do something we were taught for too long not to do. Ask questions. Don't accept every pill without understanding it. Don't follow every instruction without knowing what it does in your body. Don't get used to feeling foggy, disconnected, or slow. Don't normalize it. One of the best things you can do for yourself, and for those you love, is to review your medications at least every 6 months with a professional who understands the effects on older adults, a geriatrician, a clinical pharmacologist, or a trusted physician who listens. A single review can make the difference between living confused and living with clarity. And if you don't take many pills yourself but know someone who does, I ask one thing: share this video. Send it to your mother, your father, your aunt, that neighbor or friend who always says, "I take everything." They might not understand today, but tomorrow they'll thank you. Because at this stage of life, when we've already gained wisdom, what we cannot afford to lose is our lucidity. You deserve to age with dignity, and that starts by knowing what goes into your body, pill by pill. Thank you for being here. Thank you for taking care of yourself and those around you. If this video helped you, leave me a comment. Tell me what you discovered today. And tell me, how old are you, and where are you watching from? Your experience matters. Your story matters too. I'll see you in the next video. Until then, take care of your body, but above all, take care of your mind.